Hi, everybody. My name is Joanne Sampolsky, and I live in New Jersey. I am currently a geriatric nurse practitioner, and I work in pain management and addiction. I graduated in 2014 from Rutgers University in Camden. So when I first started going to school there, they had discontinued the mental health program due to low enrollment. And now I can see 7 years later, the psychiatric mental health nurse is a critical part, is crucial in the field of mental health. I also work at Boca Recovery Center, which is an inpatient detox facility. I started working there last April, along with another nurse practitioner who was dual certified. So when she decided to leave, they hired two other nurse practitioners who were also dual certified. They were family nurse practitioners and psychiatric nurse practitioners. So once they hired the two, they actually let me go and told me that I had to have my psychiatric nurse practitioner certificate. So I really enjoyed working at the facility. So that was really an incentive for me to go back to school. The clients we see there have a variety of issues: mental health issues, anxiety, depression, bipolar, abuse, a lot of substance abuse, alcohol, opioids, heroin. And I find that in this era today, in this COVID era right now, I think some of these issues have escalated. So a little bit about myself. I graduated nursing school in the 90s, and I've been a nurse for over 30 years. I only spent about the first 5 years working in the hospital, where I worked in the operating room. The facility I was working for, the operating room had shut down. Of course, they built a bigger, better hospital near where I was at. So our doors shut down. And once they shut down, I moved on to, I did long-term care. I did doctor's office. I did home care also. And up to this December, I was working as an LPN instructor in a facility. I was teaching actually pharmacology and I was doing clinical and some didactic with them. But once I graduated with my NP for certificate, my first job was in pain management. So I see about 30 patients per day in pain management. And like I said, this was my first job getting my certificate. I do find it difficult now that I've been working in addiction to prescribe you opioids now, because I do see that they easily become addicted and all the damage that they can cause. When I finish at Hersing, my expectation is to apply what I've learned to improve patient outcome. So I chose mental health nursing as my concentration, because I do think that nurses need to acquire new skills. And I know working in addiction is not for anyone, especially if you had family members that had issues with addiction. But I find it very rewarding to work in this field. And I know not everybody can do this because it's such a in and out. I mean, we have the same patients coming, but we had the same patients coming in and out of the facility, every 2-3 months. And a lot of them were quite young. And that was the hard part, was a lot of these patients were 18, 19, 20, young girls that are, of course, doing things to make money, to pay for their addiction. Just young guys that are just living in the woods. And I just felt this very heartbreaking. But I also found it very rewarding to be working in this field. And one of the reasons that I enrolled in Hersing is because one of my previous coworkers, she was in the same situation as me. She was working as a mental health nurse practitioner, but she only had her family degree, and her job also told her that she had to go back to school. So we went back together. We're not in the same class, but we're sort of at the same level here at Hersing. So that is my goal when I finish work. My goal is to go back and work at Boca Recovery Center, where I was working at. They did tell me that once I got my degree, they would hire me back. They also have several facilities all over, a lot of them in the Florida area. So that would be a goal for me, would be to move to Florida and start working there. All right, so everything else I put in my little bio underneath this video. So hopefully I'll get to meet some people at graduation. And thank you for your time. Bye-bye.